everyone, I'm Joyce the dentist. Today I want to talk to you about one of the biggest issues we see here in the dentist office, cavities. Unfortunately, cavities are not this cut and dry thing where you can tell for sure if you definitely have or don't have a cavity. In fact, one of the biggest myths about cavities is that if your tooth doesn't hurt, you don't have a cavity. That couldn't be further from the truth. Now, before I get ahead of myself, the first thing people need to know about cavities is that they are actually a bacterial infection inside of your tooth. All of the foods and drinks you put in your mouth during the day leave little particles behind. The bacteria that are inside of your mouth start to eat or feed on those particles. What we're left with is a sticky biofilm byproduct. Those germs are literally pooping on your teeth. That biofilm, or germ poop, if you want to call it that, is acidic. Once this acidic sticky layer sits on your tooth, it starts to eat away at the outer layer of your enamel. And when this process happens again and again, your tooth enamel becomes compromised, and the bacteria actually reach a point where they eat away at so much of your tooth that it penetrates the enamel, creating a hole or cavity in your tooth. Sometimes the opening on the outside of the tooth is teeny tiny and the cavity underneath is huge. That's why it's important to know you can't always see cavities on your teeth, especially if they start between your teeth or in the tiny little grooves and pits on the chewing surfaces. So how can you tell if you have a cavity? Well, sometimes you'll feel it. Maybe your tooth will be sensitive when you bite down on things or eat certain foods. A lot of cavities tend to trigger sharp pain if you're eating or drinking something sweet. Or maybe when you run your tongue across your tooth, you feel something sharp. Perhaps the floss always shreds or breaks in that spot. Other times, you won't be able to tell at all that you have a cavity until your dentist examines the tooth and takes an x-ray of it. That's one reason why it's important to have low-dose diagnostic x-rays taken at your dental checkups. When dentists have your x-rays, we are able to look inside of and between the teeth. That way we can spot cavities as early as possible and even before you start to exhibit symptoms or see big holes in your teeth. On those x-rays, we typically see these small, tiny little triangular shaped shadows between your teeth where the cavity is forming, or it could be a cloud-like darkness right underneath the biting surface. Since your tooth has different layers of densities, the x-rays will pick up cavities to show up as dark areas or shadows, since there's no tooth structure there to block the x-ray. The bigger and darker it is, the more serious the decay. The reality is that once you yourself can actually see a cavity on your tooth, you're dealing with way more than a small area of tooth decay. By then, you're talking about a cavity that has expanded so much, it's involving the nerve inside of your tooth and a large bulk of the tooth structure. Ideally, we want to treat cavities while they are as small as possible. Since they're bacterial infections, the cavity will only continue to spread into the adjacent tooth structure until it's treated. And get this, cavities can spread into neighboring teeth too. The sooner you treat a cavity, the easier the treatment is and the less money it costs. So let's say you're getting your cavity treated. In a perfect world, we'll clean out the decay and then seal off the open cavity with a small tooth-colored filling. Fillings restore or rebuild the part of the tooth that's missing and help us stop the decay from spreading. But if you wait too long, it's not physically possible to put a filling in the cavity. Once the bulk of the tooth is structurally compromised, a filling won't fix anything. Instead, you have to cover the entire tooth with something like a crown. The crown will reinforce the weak structure that's left behind so that it doesn't break down whenever you're biting or chewing. On that note, if the decay has already penetrated the nerve in the middle of the tooth, you'll have to get a root canal and a crown if you want to save your tooth at all. As a dentist, I want to treat cavities immediately before they spread further and destroy tooth structure. This keeps the treatment as minimally invasive and affordable as possible for the patient. Bottom line, if you have a cavity, it's a good idea to get it treated sooner rather than later. And remember, if your tooth doesn't hurt, that doesn't necessarily mean that you're in the clear. The best thing you can do if you don't trust your dentist's recommendation is to see another dentist to get a second or even third opinion. Sometimes cavities are so small or still in the demineralization stage that you might have a dentist want to watch it. So different dentists may diagnose things differently, which may account for a difference in the amount of fillings you may need. Now, if you have a cavity that's so small that your dentist wants to watch it, they may prescribe fluoride and want you to revamp your home hygiene routine to stop the first stages of decay from progressing any further. But once the enamel itself is penetrated, the inside layer of your tooth is extremely susceptible to rapidly spreading decay. At that time, you've reached the point of no return. So do yourself and your bank account a favor and don't wait until your tooth hurts. Treat issues early to protect your smile and limit the need for unnecessary dental treatment later on down the road. If you found this video helpful, hit the thumbs up button, subscribe, and I'll see you in the next one. Bye!